Hi, it's Dr. Lowenstein in Santa Barbara. I want to briefly talk about the implant pocket. That's the space that we put the breast implant into during a breast augmentation. And classically, there are two different types. The submammary position, which is behind the breast tissue itself. That is a good pocket for taking up volume if you have some ptosis or drooping. Downsides of that pocket are it has a little higher risk of capsular contracture, and it tends to show rippling and contour regularities of the breast implant more so than the submuscular position, which is the other principal way that this is done. The submuscular position requires dissection under the pectoralis muscle, and the implant is placed there. With or without some division of the lower aspect of the pectoralis muscle. If you put the implant completely behind the muscle, it tends to ride very highly and give excess upper pole or a shelf-like look here. In my practice, I do what's called a dual plane operation, where I do some dissection in front of the muscle, and I put the implant largely behind the muscle with division of the lower portion of the muscle. Now, keep in mind the muscle is a very large muscle. It goes from your arm here and inserts starting at your collarbone all the way down your chest. And so I'm just dividing the lower inch or two to allow the implant to fall into a position where the apex of the implant is at the apex of the breast. Gives a very, very nice natural upper pole. But additionally, I do some dissection in front of the muscle in the lower pole, and I use incisions on the inside there to help shape the breast to a nice round contour in the lower portion of the breast, and that's how I get that teardrop shape that I'm known for. So it's a little bit of the secrets of how I do things. Happy to answer more questions when I see you here in consultation, or feel free to call or email us. Hope that helps. Thanks. Take care.